Great. I think we're in. I can see the participant tally building up. Thank you, everyone, for joining. I'd like to extend a very warm welcome to everyone who's joining and yet to join. We do have a few minutes before we start the panel discussion. Up until then, you would see a question on the screen. Can I request my colleagues to bring it up? Uh, we'll just bring up a question on screen, and if you can scan the QR code and start to leave your response, we can wait a few minutes to gather responses before we start the discussion. So just a minute more before my colleagues bring up the question. There you go. So you should be able to scan the QR code on your phone. It would take you to a Mentimeter poll, and you can leave your question there and it'll start to show up on the screen. Alternately, you can also go to menti.com and use the code on the top of the screen and access this poll. So just a couple of minutes more before we start the discussion. Great. It's clear that technology has made its way well into our lives, and it's exactly on that note that the webinar today will focus on. So I'd like to extend a very warm welcome to everyone who has joined us for this webinar on shifting principles, shifting practice, ethical AI for health. This is part of our series celebrating 20 years of Quicksand, a milestone that we reached earlier this year. It has, of course, created an opportunity for us to look back at our work, reflect, connect with our partners and collaborators over the years, and look ahead with them. This particular session navigates the dynamic world of technology as it permeates all facets of health, as we can see on this poll. The multitude of apps and services that we use, but also in clinical care, how technology has really secured its place. And within that, dynamic world of technology, we are, of course, all grappling with this sudden delirium we find ourselves in with the emergence of AI. AI is indeed everywhere, several new innovations that have been invented on the back of AI, and several old processes that are getting replaced by AI. As a design studio, we've had the privilege and, well, the daunting task of working on these technologies where the ethical frameworks are still nascent. Just as by way of an example, we've worked on a digital peer support system for youth facing mental health issues, particularly those with suicidal thoughts. The margins of error are very, very narrow, or an AI-backed monitoring technology that reports hand washing behavior within labor room settings, or improving data quality in health management systems, trying to find ways to reduce errors in data and make data more useful and insightful. So it is really a great honor to have friends and partners back on this panel, people with whom we have developed some of these applications, studied their impact, and reflected on their ethics. I would extend a very warm welcome also to all three of our panelists. I'll start with a brief introduction and then move into the meat of the matter, which is the discussion on ethical AI in healthcare. We are joined today by Dr. Bhaskar Rajkumar, who is the Director of Healthcare Initiatives at Art Park, which is the AI and Robotics Technology Park at Indian Institute of Science. Bhaskar is a physician, but also an MBA with over 15 years of experience, spanning clinical, non-clinical, and administrative roles in healthcare. He's also an entrepreneur, having founded and run a startup called Medinit, a startup which was integrating future technologies in healthcare education. Currently, he directs healthcare initiatives at Art Park, focusing on One Health and climate change's impact on healthcare. Thank you so much, Bhaskar, for joining us. I'll move on to Shambhavi, who's Shambhavi Nayak, who's chairperson of Advanced Biology Program at Takshashila Institution, which is a public policy think tank and school in Bangalore. Shambhavi researches India's policies concerning emerging biotechnologies, particularly their applications in health, energy, and economy. She has contributed to WHO guidelines for gene editing governance and was also involved in drafting India's risk assessment of genetically modified crops. Her recent work explores exploring new technologies like AI to deliver equitable healthcare in India. Welcome, Shambhavi, to the panel. And finally, we have our dear friend, Dr. Tiggy. Uh, Tiggy is a global health physician. He's the chief medical officer of Jepaigo, a close partner of Quicksand over several years, where we've really had the privilege of working with Tiggy very closely on some of these projects. He's a physician, educator, and researcher with over 2 decades of experience in public health, clinical care, and strategic leadership in resource limited settings. He has worked across numerous countries on initiatives such as health system strengthening and disease prevention. As the CMO at Jepaigo, he focuses on leveraging data and evidence to maximize reach and impact, serving also on WHO's technical advisory group on use of medical devices and advising Ethiopia's Ministry of Health. So, welcome all three. Thank you once again for making the time, for reconnecting and reflecting back on some of the work that we have done. I will move to quickly for all the participants, how we will kind of, run the panel today is, we'll start with a framework that we've used to really frame the discussions on this, a framework on how AI is evolving. I'll give a brief introduction to that, and then move on to certain questions that our panelists will respond to over the next 30 minutes. We will come back to an audience engagement round where we have another interesting question for all of you, and then a closing thought by panelists. We realized while putting all of this together that we've perhaps done a bit of a disservice to this by giving only an hour, but we will try and pack in as much as we can. So thank you for everybody who has joined us for this session. With that note, can I request my colleagues to move to the framework? So I think the entire framing of this has been around how we've seen the use of AI, and within that, the ethics of AI evolving. I think we started with a question around, when AI really broke on the scene, the need to upgrade our health systems with AI. Immediately the conversation moved to how the outputs of AI need to be ethical. Uh, how health services that are being designed with the use of AI should be patient centered, and as designers, developers, entrepreneurs, the need for participation of people who would benefit from these applications in the design of technology, health, and policy was always a principle that a lot of us swore by. But in the in the very sort of dynamic and fast changing world of AI, I think what we've seen already in the last year as is that there are new kind of questions that get posed, which is that while we need to upgrade our health systems with AI, we also realized as we are embedding these within existing systems and institutions that we shouldn't lose what works to just kind of this blind seduction by technology. And I think all of our work would speak to that. We've also, stumbled upon the need for ethical frameworks to be cutting across the entire process of developing, testing, deploying, and maintaining AI systems, and not just the outputs that we see and that services benefit from. This conception of patient centered has moved to a much more rounded and interconnected understanding of well-being. The fact that individuals' well-being is connected to planetary well-being. So this whole movement within design, for example, to life-centered design as opposed to just patient-centered or human-centered. And finally, on the aspect of participation, the need to foster means of participation from the very beginning of even framing the problem statement of what we are trying to solve for. So this is really the framework that guides our discussion today. And I will open with a question to sort of our panelists, perhaps start with Bhaskar, and then followed by Tiggy on, you know, these principles seem to suggest that our understanding of AI and other frontier technologies is maturing with time. And the question really is, would you agree to this framing? And can you share a few examples from your recent work to make your reflections on this question more concrete for the audience? So, Bhaskar, over to you first.
Sure, thanks, Ayush. So, quickly, even before getting into AI, right? So, a couple of things what we need to look at when we are talking about data collection systems becoming a norm in itself, right? So, if we go back to the COVID times, that's when most of these data collection systems started coming into play. I was looking at the question what you raised and you asked about, are you guys using any of the healthcare applications? Surprised that nobody mentioned about the applications which were made mandatory during COVID times, right? So one of the applications what was made mandatory if somebody turned to be positive, at least in India, was Quarantine Watch or your Arogya Setu, if you remember, right? So wherever we were traveling, or even if I'm moving 100 meters, 200 meters away from the house, if I'm tested positive, it used to be tracked. So that's the level of data collection which was happening. While in a way it is scary, but other way, the amount of data which is getting gathered is also an insight. So coming back to your point on artificial intelligence, today it has become a norm. So every single sector within healthcare itself, from population health to disease management to early warning to linkage between climate and health. Also, you brought in about patient-centric to people-centric. So if you look at it from all those angles, there are initiatives at all levels again, from top down when you look at the government at the state level to the citizen centric initiatives. Everywhere there are initiatives which are bringing in a lot more data. So we need AI driven systems to bring out insights which can make decisions out of these data. If there are not enough mature AI driven solutions, most of this data which is collected will be of no use. So keeping that in mind, having AI-driven solutions and models which can help in decision making is very much necessary. But having said that, building frameworks around the use of right kind of AI technology is also very, very important. So I'll just touch upon a couple of examples since you did mention if I can touch upon a couple of examples. One, like I said, the COVID was one of the closest ones which I worked upon, where we did build a lot of technologies to collect a lot of patient data and making insights out of it and building predictions. Building on top of what we learned during the COVID times is something what we said. While there were a lot of these systems which were getting built during COVID, what really happened, like we saw on the Mentimeter now also, is a lot of this memory is forgotten. So unfortunately, that is the same thing which happens even within the government systems when a lot of this technology was found to be very useful during COVID. But as and when the COVID cases started coming down, most of the technology usage also started dropping. So people moved on to their other preferences. There were multiple other things which was their call of duty. So we, as healthcare technologists and rather enthusiasts, we wanted to see if we can build those systems which can be rather sustainable and which can be made integrated within the government system for long term. And God forbidden, if in case there is a scenario wherein there is a pandemic which comes and hits, we should not be scrambling like the way we did during COVID. So that's where we started our work on building a platform for dengue management. So we picked up dengue because it is one, of course, it is a very climate sensitive disease, and we could look at multiple angles while we are building something for dengue. Beyond that, dengue was emerging out to be a very big problem across India. So there was no state government which would say dengue is not a problem. From the southern part of India to the northern and northeastern part of India, which had not seen dengue till recent past, were seeing dengue cases. So we thought this might be a very good scenario to pick up. We started working on dengue. So essentially, when we started working on dengue is when we realized how broken the data systems were as you go deeper, right? So at the top level, when you say dengue is a notifiable disease, right? So every single case of dengue should be reported as it's a mandate. But if you look at, it's only aggregate numbers of cases at a district level, which gets reported. Very little is what you can do with that kind of numbers. But if you drill down, is where you will see the gaps in data collection systems. So this is what we are starting to build now. So fix those gaps from ground up, from where an A&M or ASHA worker or a primary healthcare center level healthcare worker is collecting the data. Building those systems from that point in time is the most important thing when we want to build those AI systems, which is going to answer me those questions. So if we leave these broken systems to be broken and start working only at the highest level, the AI engines are not going to give me any answers. These are only going to replicate what are all the divides which are already there in the physical world. So I might not get any answers. To get the right answers, we need to build and solve the problems at the ground level and fix those data gaps, which are actually a physical divide. So if we do not fix those physical divides with the digital linkages, we may not be able to solve the problems using AI.
Got it. Thanks, Bhaskar. I guess just maybe a follow-on question to that in terms of, could you contrast your experience of building, the COVID application, which was 5 years back, to now sort of this initiative on, early warning system around dengue? Like, how have the principles and frameworks changed and evolved between an AI application that was developed under a public emergency to now where you have the benefit of hindsight. And of course, the conversations on AI themselves have evolved over time. So, what is the change that you've seen? Maybe a quick reflection on that before I turn to Tiggy.
Sure. So good question, Ayush. So one, the biggest change I would say is in the behavior and adoption. So which was one of the biggest challenges when you build any such kind of systems in the pre-COVID era. So post-COVID, the adoption has been very quick. Second, the capability or the capacity to build such a systems really lagged, right? So when we are building these systems during COVID, be it COVID or multiple other systems, what we build at the state level, even here, we had to really look around for people who had such kind of capability to build such kind of systems. So today we have access to such kind of technology, uh, knowledge, which is easily accessible and not so expensive. So to build a AI-driven system back in possibly 2019-20 was really expensive. Today, it's significantly cheaper to build anything. And also the GPU capacities, accessibility to GPU capacities have also improved a lot for me to run a lot of engines and derive whatever kind of outputs I want.
Thanks. Thanks, Bhaskar. Diggy, perhaps you can reflect from your very varied experiences of building health systems, introducing technology, to really just maybe offer a critique on how some of these ethical frameworks and principles around AI use are changing, and what is it that you have noticed on ground?
Right. Thank you, Ayush, and thank you, Vasco, for that. So, Ayush, to your, original question, are we really like getting to that level of maturity? And I do believe, like, I think our understanding of data and AI is starting to mature as far as I'm concerned, as a consumer or as somebody who tries to be in the middle to essentially in the health system to broker between producers and consumers of health as they were traditionally defined. And I think we have moved from asking what AI can do to considering how it should be designed, tested, and implemented. Those are some of the signs of maturity that I see, and designed ethically and with people at the center. So let me give you a couple of examples that where I participated in using this. So in Nigeria, we worked with a South Africa-based technology company to deploy an AI-enabled predictive modeling tool that really was meant to help us identify individuals at risk of interrupting HIV treatment. Reasons being as simple as forgetting to take medications, to fear of stigma, or like a general low trust in the health system, right? So it's a genuine problem we have in health system. So when we used this predictive tool to follow some clients compared to others that we haven't used this tool to follow, they were 4 times likely to continue their treatment. And as you all know, this is a huge achievement in keeping clients on lifelong treatment. So it's a huge success. But the real success wasn't just the algorithm, because there was a lot of focus by the government of Nigeria, by all of us who were participating on how the algorithm enabled us to do that. But as we look back and as we start to look at the data, some of the things that we saw was it was on how we were able to embed it into the local health system and how we trained the providers and ensured really like respectful, non-judgmental follow-up. Now, all of these themes are completely different from what the technology at the beginning talked about. So it was really, in my mind, it was a model of like ethical implementation that valued both equity and effectiveness. It didn't happen automatically. And one of the lessons is it wasn't really designed that way. There was a rush in deploying the technology. So the point there being, Ayush and team, is the learning and the maturity happens along with the deployment. So that really requires us to be having a watchful eye and a watchful ear on a day-to-day basis, starting from the very beginning of deployment of a solution like that. Similarly, in India, this is something that we work with the Quicksand team. We use the Vajrahan technology, which is again another AI-powered device that consists of a camera and a processor and a screen installed above a hand washing station, typically where healthcare workers wash their hands. And the intention was to have a direct monitoring of what is happening, with the aim of providing a real-time feedback on adherence or compliance to a very like a simple 6-step hand hygiene protocol. Some of it like developed by the government of India, but also promoted by World Health Organization. 6 steps, and I hope everyone on this call already know this and use these 6 steps for hand hygiene. Why did we do that? And the system also was meant to aggregate data or user data into a certain dashboard somewhere in the hospital so that managers can see, so that they can enable tracking of compliance with the sole intention of improving performance. and improving quality of the work. Now, all of that is good. And why we wanted this solution, just because it's important to bring everybody on the same page, is there is enough evidence telling us that hand hygiene, just a simple act of hand washing, is one of the most effective ways to prevent the spread of infections. It's not really all the fancy innovations and technology in sciences and medicine that prevents infection. It's really that basic act of hand hygiene that is powerful, yet compliance remains awfully low globally. And it becomes worse in overstretched health systems, like some places that you probably see in India and globally. So we thought this solution offers a promising path, allowing us to not, behavior change in real time, and close the feedback and help protect both patients and providers. But it raised an important question. Everybody was excited and all. The question that we're trying to answer is important. The solution is meant to address it. But how we were able to balance real-time feedback with a concern about surveillance, that was number one question. Are you here to actually surveil what I do? You don't trust me in what, the service that I provide? What about my dignity and integrity as a healthcare worker by you putting a camera on my day-to-day movement in the different department in the hospital? That was a huge red flag. So in this case, I think, the ethical deployment wasn't just about the device's accuracy, which we wanted to use the data for, but it was really about that community engagement, the transparency that we bring, and the respect for cultural norms. And hence what I said at the beginning, I think we're in the path of maturity. I hope we'll get there fast. Like everything in AI, things move very fast. So I'm hoping that evolution that accompanies our adoption goes fast. So for me, both examples I demonstrate that ethical and responsible AI requires more than the technical excellence, which is good and important. It demands, I think it might seem off, but it demands humility to start with. It demands this idea of really envisioning this idea of co-creation. I know we use that quite a lot, but what does that mean? And a broader view, and I like what you said about a life-centered design, a broader view of well-being. Because historically and traditionally, health and healthcare facilities were almost like attached at the hip, as if that is all. But well-being comes, really 80% of the well-being comes outside healthcare facilities or the four walls of healthcare facilities. And hence, the design need to have that broader and expansive view of what well-being is. And that by necessity need to include both people and systems that are within and outside the health system to support them. So not presenting it as a critic, but I think as a word of caution that there is an active learning that we need to have an effective deployment that is respectful and moves us forward. Let me pause there and see if that makes sense, Ayush.
No, absolutely, Tiggy. I think you raised really important kind of questions around the fact that AI technologies will continue to evolve at a pace that often the developers and creators of it will find hard to match step with. And therefore, this mindset of how do you evolve the systems and your learning as you deploy becomes almost a kind of a non-negotiable in the development of these technologies. I think it's a great segue to my question to Shamvi, which is, going back to those principles that we spoke of, from patient-centered to life-centered, from participation of just the user, in the creation of it, but also from the get-go in terms of consent of data, in terms of governance of data, etc. I wonder if you find these principles too optimistic, because when we first spoke, you mentioned how AI and other frontier technologies are considered often a silver bullet in policy circles. So can you maybe reflect on what are the attitudes you are seeing around AI governance at the state level, because that will also determine what the state of play is as we go forward at this.
Sure. Thanks, Ayush, for that question. And before I talk about AI, obviously, let me talk very briefly about healthcare governance and public health governance, because that is complex enough anyways. I'm talking from an Indian perspective because that's the healthcare system that I've more studied. And obviously, we have multiple systems of medicine in India which are governed differently. We have a huge urban-rural infrastructure divide. We have public versus private healthcare, which again creates disparities. So you're already looking at an extremely fragmented sort of healthcare governance to begin with, and AI kind of adds a layer of complexity there. And I completely agree with what Dr. Tiggy was just saying, that perhaps AI may help illuminate actually some of the complexities that have been hidden away from us so far in healthcare, and bring them out and hopefully help us address those better, right? From a state perspective, obviously, in India, healthcare is the responsibility of public health and healthcare is both distributed within states and the union government, which means that they're primarily the stakeholders which are involved in service delivery. If you think about the healthcare supply chain, obviously there is service delivery, but there's also has to be a strong communication component, right, from the public to understand where the gaps are, what the requirements are, etc. And at a very broad level, I think AI fits wonderfully there, because AI can not only aid with healthcare delivery, but also just learn from on-ground experiences, like look at the gaps, communicate them back to the policymakers that, look, this is where we are seeing issues. And while all of this seems really nice on paper, obviously it is not that simple at all. We often see governments see a problem and say, hey, we need to do something about it. There's AI, let's just deploy, that's doing something rather than doing nothing. And AI is a very, it's easier to kind of deploy maybe than, actually trying to find the human resources that are required to solve that problem, send people off to remote areas, for example. Sometimes offering an AI might just be on paper an easier solution to deal with, but that's, that's not going to solve the problem. We use a lot of words in governance, right? We say cost to benefit ratio, we say trade-offs. And again, all of that sounds really nice on paper, but it is very difficult to sometimes quantitate. When you ask that question on Mentimeter, the first response that I saw was someone said that I love healthcare apps because they help me connect with loved ones, right? How do you quantitate that benefit to a person? It's very easy to say that you deploy an AI, it will help you do drug discovery, or it will save a person's life. Fairly easy to quantitate and say that, okay, the cost for putting this AI might be worth it. But when I says it connects me to a loved one, it's a little difficult to actually make that tangible for a policymaker to understand, right? On the flip side, we have cost. Again, we understand costs in terms of money fairly well. But again, through the Mentimeter, a lot of questions around privacy of data, right, that came up. Consider the scheduling app. It's great for a doctor. It will save the doctor's office a lot of time. It is also great for the patient because it will save the patient a bit of time. But obviously, the benefit is much more to the doctor, because across patients is going to get easier for them to deal with multiple patients. But a lot of the data is going to be of the patient. So the cost, the privacy concerns are mainly driven by the patients. The benefit is mainly to the doctor. As a state, how do I look at this, right? How do I look at the cost to benefit when the cost is higher for one stakeholder, but the benefits are higher for the other stakeholder? Eventually, yes, the benefits spill over, they will reach out to more patients, but the perceived safety concerns for the patient is going to be higher, right? So when you even think about cost to benefit for AI in healthcare, it is just so complicated. I think the next principles were about that AI has to be well tested, well trained. Again, I agree with those principles, and I have myself used them in other forms of emerging technologies in biotech, right? But it's also going to be a little complex because let me give you an example. Suppose there's a rare disease, right? And AI can help with, say, diagnosing that disease. Now, to actually be able to roll that out, you might want to test it on, say, 500 patients. That's what the government says needs to be done. That's somehow the number that you have to achieve. Because it's a rare disease, finding 500 patients might actually be difficult. Do you wait till you find those 500 patients, or at the level of 250 you say like, look, I have measurable confidence in this AI algorithm. It will help me expedite treatment to other people. But you are now stopping me because you are saying that, it has to be well tested. So that definition of what is well tested, what is well trained, um, is different for different diseases, it's different for different scenarios. And we're going to have to question ourselves on how much willingness we are going to have. Either we are going to be bullish, we can't be completely bullish on AI either, but we can't be completely bearish on AI either, right? So finding that balance is going to be difficult, and I think that's where governance for AI is really throwing up some nice questions for the policy analysts out there, right? Um, and then on top of all of this actual science and technology bit, there are political angles. Some states might just want to say that we are technology forward, we are technology savvy. So we are, and here's an example of how we are that way because we are using deploying technology. Some states might be, hey, AI is linked to AI to job loss. We don't want there to be job loss. So we are just going to avoid it. And some might just be the let's do something category and want to do something. And it is very easy now to kind of get caught up in the hype because of the narrative building globally that about how useful AI is to healthcare. And without actually contextualizing to India, we might see some states using it unnecessarily or kind of using it to gloss over the fact that there are deep institutional inefficiencies that we're looking at. And to the final point on being planet centric, which I really love that point, because a question that we often don't raise when it comes to AI is where is the compute power coming from, right? Who is feeding the electricity that is required for all of this? Where is the data being stored? Uh, and what is the opportunity cost of doing all of that? I come from a village near Goa, and we don't get internet half of the time. We don't get electricity half of the time, right? So if you say I wanted to deploy a AI based healthcare tool there, first there are going to have to be some trees felled just to get up the electricity setup, right? Um, and phone networks put in, right? There has to be some infrastructure that has to go there. Um, and then we obviously have to see those data centers, etc., come up. The effect of environment, the effect on the environment of all of that, the unintended consequences of all of that is something that is rarely talked about when we speak about AI in healthcare. And I think that has to be also a part that we have to deal with. So I think the principles are great. They're a great starting point. Uh, we perhaps have to kind of reflect a bit on them and see what some of those terms really mean when it comes to on-ground governance. Thanks, Ayush.
Thanks, Shavi. I think your points kind of hark back to the point around maturity of using AI because it also feels like, and often in policy circles, it also always feels like there is an archaic framework that is used to govern emerging and new technologies, and that mismatch is perhaps even more acute in when you look at AI and the pace at which it is evolving. Sorry, I'm getting constant messages that I'm not keeping this in time, but I do want to segue to the next part of this discussion, which is around participation, because I think all of you have really good examples of what participatory design of some of these technologies really means. And so, can I maybe request Bhaskar for you to reflect on some examples from your practice on how the systems that you have been in charge of can be made or have been made more participatory? And if I can request all of you to perhaps keep your response to maybe under 3 minutes.
Sure, Ayush. So I did touch upon the dengue work and the COVID work, try to keep the chain intact so that the connection is there. So if we go back to the COVID times, one of the systems what we did build in was for patient data management, or we called it as index during COVID. We had something called as an index case, which used to be the nodal case from where the COVID disease spread. So we called the software as index, and why do I call it participatory? Because if you notice, there were these multiple mobile applications and software technologies which were used to manage multiple stages of the disease. So testing was done through a certain application. All of us would have got done COVID testing. There was one application which was tracking testing data. From there, it goes to the lab, and then if the patient gets tested positive, then if he gets quarantined or home isolated, there is another application which is tracking his quarantine duration. There is another application which will be built to manage what is he doing during his he's being isolated, and there is another application if he gets hospitalized. So there are multiple applications. On top of that, there are applications where the patient himself was made to report back on his symptoms, how is he feeling. So what Index did is to try to engage with all the applications. So as a matter of fact, during COVID, when we built this, there were 14 different applications which had to be brought in together. From citizen science to the hospital management systems, everything in between to ambulance management, all together. There are 14 different applications developed by 14 different organizations brought together to have an integrated patient data at one single place. So while this was done, so while we are building for dengue also, this is a similar approach what we are looking at. So when we are predicting or outbreak of dengue, one of the most important things is understanding how the vector dynamics is, right? So vector dynamics depends one part on climate, another part on human behavior and urbanization. So, but if you look at the public healthcare workers, they track only a small section of the overall society. As a very big chunk, at least the urban society is left over because it is not catered to by the public health systems. So that's why citizen science is some one angle where we have built in, so that there is significant amount of participatory contribution from the citizen science or the citizens themselves, so that they can report where the breeding spots are, they can report if there is a case somewhere, so which will all contribute to the larger data system and help us in decision making.
Got it. That's cool. So it's almost kind of turning the technology to assist you in participation, as opposed to perhaps what might have been more traditional ways of including participation. Shambhavi, we know that there is a process where policies are open to public for feedback before they're published. Would you call that participatory, and how do these feedback loops really function for something as specialized as AI, where some of the implications of that are perhaps even harder to forecast? So, this again, like the archaic framework of putting a draft policy out, seeking public consultation, does that work for AI?
Well, I think the process by itself, in my experience, has not worked very well. And this comes from the life sciences. But I understand this depends from ministry to ministry, state to state, etc. So there's some departments, some committees which are extremely good with getting feedback and incorporating that feedback, and some that aren't. And I think in the case of AI, uh, it's not something that we should just leave to chance on how good a committee might be or a ministry might be, right? Having said that, it is difficult to. I mean, one of the reasons why participatory policy making doesn't always work is because it can introduce delays. Because there is very low probability that everybody in a community might be okay or agreeable to a certain technology, right? And if they are not, what happens then? So the idea of participatory democracy and participatory or consultative policy making is not to get everybody agreed to a certain position, but to be able to understand their views and to be able to mitigate any big problems that you see, while always saying that, look, we think that the cost to benefit, there has to be some evidence on why you want to still deploy a particular technological solution. Last year, we did a big project around synthetic biology deployment in the Indo-Pacific. And this is what we came up with, that a framework that looks at perceived agency of a person to be able to interact with a particular tools, to say use it or not use it, versus their perceived safety because of the introduction of that tool. Based on that, we can basically create different categories of engagement. And if something is going to be perceived to be dangerous and people feel they don't have a choice in actually adopting that tool, then you need that form of participatory policy making, which involves people right from the beginning. And if people say no, then it's a no, right? But if something it's actually safe, people have agency to not choose it, you don't really need to go all out and speak to everybody, etc. So we had kind of created a tiered format for engagement. Because otherwise there is from a governance perspective, I understand why there might actually be a stall to technological deployment as well. And so you want to, again, strike that balance.
Thanks, Shambhavi. And quickly, to Tiggy, to you, just in terms of, what role can design really play to strengthen people's participation, especially when you're talking about ethical AI. And I think you've touched upon some of this in your earlier
Yeah.
response, but maybe you can also reflect on the limitations to it as we see it.
Yeah, maybe I can also, in some of the the chat conversation, there are some questions that might be useful to reflect as I talk about it. So first of all, thank you. I think what all the panelists said is really true and important, that we need to be mindful. And I do believe design can play a critical role in really strengthening participation by essentially by serving as a bridge between high level principles and real world system. So it really, like in its basic forms, what kind of questions need to be asked vis-a-vis what are the principles that we need to uphold. So let me just give one example. The World Health Organization, as we speak, has a guidance on ethics and governance of artificial intelligence for health that emphasizes inclusiveness and equity. Now, when you read that, it does make sense, but everybody would ask, what does that mean? Right? It is really important, and it's a core principle. It urges AI systems to be developed through meaningful engagement with diverse stakeholders. It's especially those most affected. All noble ideas, but it raises a familiar question, like the one you raised: should participation be pragmatic? What participation are we looking at? Can we always involve those closest to the impact? I think we just need to have that emphatic answer. I think that believed to be, it lies on how we approach design. So it's not only like design as a role, but how we approach design. Bear with me, I'm just a student of design, so you can take this with a grain of salt. If design is treated as a consultation as opposed to a co-creation, then we're going down the drain. So the language, the way we approach design is going to be important. It gives shape to whatever we call inclusive participation. So hence that translation of principle to real world. It helps identify moments that matter. There is the bigger concept, but moments that matter. I say that from the basic examples I gave earlier. What does it matter? What moment is important for a nurse or a physician on her work in a day that really motivates her, stimulates her to provide high quality care for her patients? We can cite multiple research to make a determination of what that moment is and design towards that. But unless we have that approach of a design where we ask a question that matters to people, then we'll be going in circles. So I'm trying to make it to the basics of how those lofty principles get translated into real world experience through design. So the example, let me go back briefly to the example that I gave, that I work with your team, Ayush, on using the vaginal hand for hand hygiene. One of the things that we had to look at and make a decision is, how should feedback given? What should be the feedback mechanism? What is the sound of feedback from the machine? What's the language that we use when we provide feedback? Now, if you sit at a desk and very much excited about the technology, you might find this question so mundane. But when you talk to the provider's front line, that becomes the most important question. So it is really so this is where I'm trying to, bring your question into the role of design as a very, very important step, but the approach needs to be really looked at. So while full participation may not always be feasible at every stage, but design must offer I think an intentional structure. It must continue to help translate principles. I'm hammering this concept again and again. Help translate principles that, the likes of the World Health Organization put forward. All of those things are nice, but the translation is where we get lost. So like issues of transparency, accountability, and inclusiveness that was discussed, including some of the questions colleagues raised. This needs to be translated into concrete practices that center people, not just processes. So to end my reflection, Ayush, these shifts are occurring, but are at an early stage as far as I'm concerned. So as the fanfare of new technology often eclipses such grounding principles, and these are the complexities of healthcare, as Shamvi said earlier. But the promising thing in my mind is design can actually be a response mechanism to such complexity.
That's fantastic, Tiki. I think you've given us so many axioms in your closing reflection. Consultation versus co-creation, moments that matter, and finding those, and really sort of privileging those, but also just what is design's role and how we use it as a way to kind of navigate this. Thank you so much. I think we have now sort of maybe 6 minutes, but we might extend it to 10, where I'm going to open a question to all the audience that we have. And we can pick up any question that this is to all the panelists that you think is something you'd like to reflect on as your closing remark. So can we bring that up on the screen? Thank you. So really, this is to all the audience that we have. One question on ethical AI for health that keeps coming up in your research or practice, but that doesn't get adequately covered in public fora. So anything that you as practitioners, as researchers, are really kind of preoccupied with, please leave us a question. And then my request to all the panelists will be to pick up one question and really close the session with a quick remark, maybe under a minute, because we may not have too much time. So this is open to everyone. Please, you can start to submit your questions. And I would urge everyone to do that in the next minute so that we can really try and close this on time. Someone needs to get that going. Or if there aren't questions, then we can perhaps even kind of take some from the Q&A. Oh, there you go. That's a really interesting question, actually. Okay, maybe a minute more. We'll wait for a couple of more questions to come in, and then I'll turn it over to the panelists. I think there's the Mentimeter QR code that is hiding that one question. So yeah, maybe you can just take that out. Yes. Okay. I'm going to turn it over to our panelists. So anyone who'd like to pick any question and really close the session with your remark, take your pick.
Yeah, maybe I can get started on a couple of the question, who's responsible for digital literacy in some of these AI for health programs? I think looking at AI as one additional tool in the arsenal of tools that we have in healthcare is an important framing for the healthcare system. The same way healthcare adopts new developments, whether in in pharmaceuticals, in clinical procedures, new research. So AI is an enabler. So it has to be in the education system, in the deployment. I think Shamvi was talking about in the actual implementation of health system. It is going to be everybody's responsibility. I think one of the risks is because of the focus, there is a tendency to have a siloed conversation about people who only know about AI and work on AI and provide guidance on AI. But I think the future is this needs to be sparsed clearly in everything we do. So ultimately, it becomes a responsibility of everyone, from the production of healthcare workers to the actual implementation and care and receiving care. And I'll just and by saying this idea of the technology is always put in a positive light, it's a very true challenge we have, right? Everything that is challenging, there is a social desirability bias that if you say this is not working, everybody will be giving you a look. So you might as well agree with that, what everybody said. And I think that's also where, from a design perspective, we need to create a space that allows for diversity of thoughts, diversity of experience, and diversity of critics that will only improve the future of using AI in our healthcare.
Thanks, Tiki. Bhaskar, maybe you can go next.
Sure, Ayush. So I won't pick on a specific question there, but if you look at the question, there seems to be a trend. So I'll just pick on the trend and respond to that, right? So most of the questions are around accuracy, accountability, and ethics around AI, right? So while we still deliberate a lot about, and this is a discussion across the world, accountability and accuracy of AI is the biggest discussion today across circles, right? So while we are looking at that, considering the topic of today's discussion, ethical AI, one of the most important things when we're talking about ethical AI, all of us should understand is, can we keep people at the center and still work on AI while we are answering any of the questions? Second, when we are working on AI, another thing what we need to realize is this is not the silver bullet what we mentioned. So when we are referring to any of the solution given by AI, we should not consider that to be sacrosanct, but it is only an enabler for us to take better decisions. That the decision itself is not come only out of AI. So that's where our intelligence comes up. And also where we are looking at technology while we are building a lot of this comes again to the questions which are positive, pointing at why are we so optimistic and why is there a social bias about newest technologies. We need to have a fair bit of optimistic approach, but with a caution considering how the technology is growing and changing. So we should not be cynical about technologies. If we are too cynical about technologies, we may not be able to enhance the technology in itself. So we need to be optimistic about how the technology is growing. Only then such kind of technologies will become more helpful for the generation of tomorrow. So specifically, if you're looking at healthcare, how can we make it to contribute for a healthier tomorrow? How can we make it more equitable? These are all the questions which are being asked when we are using AI-driven technologies, right? So we'll have to be optimistic and believe that this can solve, and only then figure out the gaps which can solve these issues within AI-driven systems.
Thanks, Bhaskar. And finally, Shambhavi,
I'm going to talk about how AI will help the public sector evolve and transform, and I think it will go either two ways. If the governance structures can correctly identify the gap of benefit that an AI can bring to a certain healthcare problem, and deploy it meaningfully, with thoughtfully laid out infrastructure or upskilling of people that is required to deploy AI, it can definitely help bridge gaps and create more equitable outcomes, healthcare outcomes for both public health as well as healthcare. If we use it as a band-aid, if we do it without thinking because it is a something to do option, it will erode public trust in both AI and in healthcare. And I think that from the road from there on is going to be much more hazardous. I'm going to go back just very briefly to what Dr. Tigi was saying about equity and uh, ethics by design. And I think there is a lot of ground that AI now can help us. It can help us reassess the gaps, and think about how we design healthcare with an AI added on, rather than just saying that we're going to layer in top of what is existing. So if we take that approach, I think it is going to be great. If we don't, then it will be problematic.
Thank you. Thank you for your very, very insightful reflections. I'm not going to attempt to summarize this, although my brief was to do that in the final 5 minutes. I think we've gone overboard by 3. But, just hearing from all of you at the level of practitioners, at the level of system builders, at the level of policy advisors, I think it's clear that we moved on from, maybe a couple of years back when there was some cynicism. There is by and large an embrace of this technology, but it has certainly moved our thoughts and ideas of how, and we only benefit from the experience of having deployed this at scale to build better. So thanks once again. I think I'm grateful for your time and for your wisdom. We will be sharing the recording of this on our social media channels, so everyone who's still around can certainly go back to it. And the contact emails of our panelists will also be there. So if you need to write into them with any kind of pressing issues or questions that you haven't gotten an answer to, please do. So thank you once again, and look forward to being in touch and building kind of this future together.
Thank you.
Thanks all.
Thank you.